As we move the NHS from an era of paper-based records to one in which all information is held on computer systems, we need to make sure it can flow seamlessly between providers in order that patients are best cared for. That's where the Local Health and Care Record programme came from.
You know, the idea that paper is secure is, I think, ridiculous. You know, looking for paper notes, requesting paper notes, writing is not legible, pieces are missing. I think that as people start to move towards electronic communication, they do see the benefit, and that's clinicians and patients alike.
My mum is getting older. She's a person with diabetes. She has a multitude of other problems. And even I sometimes struggle to remember all her medical problems. If she goes into hospital and I'm not there with her, she can't always relay all that information across.
So what's it mean for citizens, for patients? One is an end to the frustration of having to repeat yourself endlessly as if the information has never been collected by the NHS before.
I personally wouldn't want to be telling every healthcare professional, oh, by the way, I've got cancer. Patients get sick of repeating what medications they take. They don't always remember because it could be on 10, 12, even more tablets on a daily basis.
It's because patients would often ask me, well, why can't you see all this? Why can't you see this information? They're often amazed when you say, well, up to now we haven't been able to do that in out of hours or in hospital.
We need to let people see their own records and own their own records, understand their own records. The most dramatic examples of this are people with long-term conditions who are part of a care planning process that describes what we need to do if things go wrong for them.
So we have a patient who lives in Hull, and they also see their other specialist in Leeds, and they're coming to us in Newcastle to have a bone marrow transplant. Obviously this patient has a very rare disorder. They are having lots of blood tests and different things are happening to them in these 3 different hospitals, and yet we don't have all that information. So they can become seriously unwell, they can have a life-threatening bleed, and we won't have access to those tests, to what's happened to them. And that kind of sharing of data and the ability to see it really quickly so we can make decisions is absolutely of the uttermost importance.
Data sharing frees up time to care, to spend with the patient. An electronic version of a document or referral that could have taken half an hour can be cut down, simplified to 5 minutes.
It saves a lot of time. I don't have to go around all of the GP surgeries asking for patient summaries.
There is no urgent phone calls from any department inquiring about someone's problems, clarification on medications, and certainly our prescribing team that look after the prescriptions for 10,000 patients have certainly noticed less traffic from hospitals asking about patients' medications.
Around about a couple of weeks ago, there was somebody who was referred to us in the middle of the night. It was 3 a.m. They were in such a distressed state that they really found it very difficult to communicate. They were experiencing a really florid psychotic episode. We were able to access data sharing and get a lot of information in regards to this person's previous mental health and medical history, which really informed the decision making and enabled this person to get the correct care and treatment.
At the moment we know there's an outbreak of measles in the Newcastle area. Now, if we had that data, we would be able to spot that pattern quicker and therefore put preventative measures to stop the spread. A few years ago, we were looking at Ebola. And if we have the ability to track these different infections, this in the future is absolutely of national importance.
So bringing together health and social care is one of the big challenges facing us at the moment. We have a significant amount of work up and down the country to help people, for example, get from a hospital to a social care funded place in a much more streamlined way.
So there is a project in Bristol which covers the whole of Bristol, North Somerset and South Gloucestershire to connect healthcare and social care in as many ways as possible. In one place we can view all the data that is streamed into this project in real time. I remember a man who was in the army and he arrived back to wander the streets addicted to various drugs. I was able to immediately see that he has had services around Bristol before, and putting the jigsaw of his life together was much easier.
I mean, the vast majority of our patients have chronic health conditions, see multiple doctors and nurses and social workers, throughout the year through multiple appointments, and the priority for them, I think, is that that all those clinicians are talking to each other and talking to each other in real time.
If I was a patient, I would definitely want my data shared.
I would definitely want my data shared.
If I was the patient, I would absolutely want my data shared.
I would like my data shared. I have numerous allergies, including a latex allergy. So if I was run over in the street, I would want somebody not to pick me up wearing latex gloves.
So not having access to the tests that a patient may have had done a week ago, and therefore you can't prescribe certain medication, I don't think in this day and age is acceptable.
We know that technology can make our lives so much easier. We need to bring that same transformation into the NHS and make staff and patients' lives much, much better.